All right, let's get right into it. Constipation. It's super common, right? But when you walk into a pharmacy, the sheer number of laxatives can be overwhelming. So the key is to stop thinking of them as one thing and start thinking of them as a toolkit, a set of specialized tools, each designed for a very specific job. And in this explainer, we're going to open up that toolkit and figure out exactly what's inside.
I mean, we've all been there. That uncomfortable, kind of blocked feeling that just ruins your whole day. Well, it's that exact problem that this whole range of medicines is built to solve. But as you're about to see, they all go about it in very, very different ways. So let's kick things off with the options you'll see the most. Oral laxatives. We're going to break down the 4 main categories you'll find on the shelf. Each one has a completely unique way of, well, getting things moving again. 4. That's the number to keep in your head. Let's look at what they are, and more importantly, how each one actually works. First up, we've got the bulk-forming laxatives. The easiest way to think about these is like they're tiny little sponges. Their job is to soak up water inside your gut, which increases the size or the bulk of your stool. And that extra bulk is what helps trigger your body's natural reflex to, go. A really common example you might have seen is Fibajol. But here's the crucial part. Because these things act like sponges, you have to drink plenty of water with them for them to work properly. And, this is really important, you want to avoid these if you're already severely backed up, what's known as fecal impaction. In that case, adding more bulk could actually make a bad situation even worse. Okay, next tool in the box, osmotic laxatives. So if the first type were sponges, these guys are like powerful water magnets. They work by literally pulling water from your body's surrounding tissues directly into your bowel. All that extra water softens everything up, making it much, much easier to pass. The 2 big players in this category are lactulose and macrogol. And even though they both work like water magnets, they're not exactly the same. And for some people, that difference is a really big deal. And here's why that difference matters. See, lactulose is a type of sugar, and the bacteria in your gut can ferment it. What does that mean? Well, for some, it means a lot of gas and bloating. And that's the absolute last thing you want if you're dealing with something like irritable bowel syndrome with constipation or IBS-C. That's exactly why macrogol is often a much better choice for those folks. It tends to be a lot gentler. All right, let's move on to our third tool, the stimulant laxatives. I like to call these the motivators. Now, unlike the others that work on the stool itself, these guys target the walls of your intestines. They actually stimulate the muscles to contract and create those wave-like motions that push everything along. You'll recognize these by names like Senna, bisacodyl, which you probably know as Dopalax, and sodium picosulfate. They are very, very effective at directly triggering a bowel movement. And our 4th and final oral tool, the stool softener. Think of these as the lubricants. They work in a pretty cool way by allowing more water and fats to actually mix into the stool. Now, this doesn't necessarily make you go, but what it does is make the stool a lot more slippery and easier to pass when you do go. The main example here is Docusate. Its whole purpose is to make the process smoother and way less difficult. And that leads us right to its most important use. And this really gets to the heart of why this specific tool even exists. I mean, think about it. If you're recovering from surgery or you're dealing with something painful like hemorrhoids, straining is the last thing you want to do. The whole job of a stool softener is to prevent that straining, which makes it the absolute go-to choice in those situations. Okay, so we've covered the entire oral toolkit, but what happens when the problem is more immediate, more severe, and, well, specifically at the very end of the line? For that, we need a totally different set of tools, rectal laxatives. For this kind of situation, there's a pretty clear path. When there's a blockage right at the exit, a condition called rectal fecal loading, the first step is usually a glycerol suppository. If that doesn't do the trick, or if the situation is already pretty severe, then you move up to the next level, a more powerful tool called a phosphate enema. So we've laid out all the tools on the workbench. We know what they are and how they work. Now for the most important part. How do you match the right tool to the right job? This table really sums it all up, doesn't it? If the main goal is to avoid straining after surgery, you're going to reach for a stool softener. If you have IBS-C and are sensitive to gas and bloating, macrogol is almost certainly a better bet than lactulose. Dealing with a severe blockage, you absolutely stay away from the bulk-forming agents. And for that immediate blockage right at the end, you look to rectal laxatives. See? It's all about matching the tool to the specific task at hand. So now you have a much clearer map of what's out there. This isn't about replacing medical advice, of course, but it's about empowering you. So the real question now is, armed with this knowledge, what kind of smarter, more effective conversation can you have with your pharmacist or doctor to find the solution that's truly right for you?